We're going to do a three-part series on silicone safety and use. I think silicone is one of those things that you see really scary celebrities having performed and you don't know if it's safe. You hear people say, oh, don't do it because my friend had it done, it was really bad. But the thing about silicone is that it can be very safe. I'm not here to sell it to you, but to give you the other side of the picture. What's really important is getting a fair shake on this and understanding it. So we're going to break this into 3 separate video logs so you can understand this a little bit better. I have written about this in the blog on my site, but I think there's not enough wide readership, and there's nothing like a video to communicate this more effectively. The first video log today, we're going to talk about the silicone in terms of some of the breast implant issues that have arisen over the last decade. As you know, in the 1990s, Dow Corning went under, and really because of some of the fears that silicone was impacting on collagen vascular disease, creating lupus, Sjogren's disease, and things of that nature. Women were complaining of certain things. And what's really interesting is that they've done extensive studies, and we're not talking about extensive studies where you have 1,000 women. We're talking about hundreds of thousands of women enrolled into these studies through multi-centers, multi-institutional studies to evaluate whether there's any causal link with the presence of silicone and such conditions such as collagen vascular disease. What's really interesting is they found that there was no such causal link. That is why, as of January 2007, breast implants are back on the market. Now, here's the thing that's really important. What I'm going to be focused on these 3 video logs is going to be understanding the nature and safety and usage of liquid silicone. So I don't want to make equivalence between these two, but the presence of silicone in the body is something that has been shown not to affect the presence of collagen vascular disease, etc. So what's more effective, I'm going to go ahead and read from an article that reviews some of the studies, because I think it's better than my sitting here just trying to quote data out of the air, but to read it. So I'm going to go ahead and do that right now. So starting in this is from the Archives of Facial Plastic Surgery, and this is the quote. Starting in the early 1990s, numerous investigators attempted to clarify the debate spurred by case reports and anecdotal data by designing large, systematic studies to quantify the strength of association between breast implants and connective tissue disease, if any. The most convincing of these investigations involved approximately 6 large retrospective cohort studies that followed up patients, and cohort means that they're actually evaluating against patients that did not have it. Cohort studies that followed up patients with breast implants for up to 10 years or longer and detected no increased associated risk of connective tissue disease such as rheumatoid arthritis, scleroderma, systemic lupus erythematosus, polymyositis dermatomyositis, Sjogren's syndrome, and mixed connective tissue disease. At least 3 of these studies from the Mayo Clinic, Rochester, Minnesota, Sweden, and Denmark aspired to being population-based on querying female health professionals enrolled up to several 100,000 subjects each, thus greatly minimizing the risk that even small adverse effects would fail to be detected owing to inadequate sample size. While biases, including selection bias, recall bias, and information or measurement bias may have skewed the results of individual studies, collectively they yielded results that were close to unequivocal. That's a pretty powerful comment. Now, obviously, I'm not here to make any blind promises, or actually what's interesting is they've actually found in some of the studies that the incidence of collagen vascular disease was lower in those that had silicone breast implant. Now, obviously, silicone is not here to prevent collagen vascular disease. It's just the fact that there is no causal link as far as most of the meta-analysis out there. So I just wanted to have you understand the nature of collagen, both solid and liquid, but these studies were really dealing with solid silicone breast implants. Now, obviously, in the old days, if there was just a bucket of liquid silicone pouring into the chest cavity, that's not safe. We're not talking about that kind of liquid silicone, and we're not even talking that kind of solid silicone. But I just want you to really sort of understand the whole picture when it comes to the issues of collagen vascular disease, breast implants, and liquid silicone, and just understanding the nature of silicone in terms of that element of safety. And we're going to continue with our safety videos coming up.